finding that balance between providing support and allowing mentors to develop their own independence and critical skills sometimes is a little bit of a thin line, right? I believe that a common misconception might be that mentorship solely involves this sort of direct guidance. I'm going to tell you what to do, and because of that, it potentially hinders the mentee's ability to think independently and problem solve. But myself, I mean, as a young healthcare provider, I went from being a full-time PT student like everybody, right, to working in a level 1 trauma hospital and splitting my time 50% or more in critical cardiothoracic ICUs and step downs. So I was working with comorbidities that I didn't even know how to, how to enunciate. And I was sure I was helped by senior PTs and I was trained per se. But fortunately, I still had my mentor at that time, Don Shaw, who really encouraged me when I spoke to him to explore solutions, right? He provided me with resources, and this approach helped me, of course, gain more trust in him, but it was always about analyzing the situations themselves as opposed to him just telling me what to do and what's the best way to do things. So once I got to my place where I'm like, this is what I want to do, it became a really great place to start discussing um his opinion versus mine. And I can't say that I always agreed, and sometimes I disagreed. And when I disagreed and I went a different route from his advice, I had concrete evidence, or critical, I had critically thought through everything, and I'd put those I kind of put everything together myself at that point. So really, in summary, I mean, my belief is that effective mentorship really does involve, it is that fine balance, but it does involve forming and or fostering the independence of the mentee, while the mentor themselves acts as a guiding force, right? Like, I'm just going to help you through these um, hills and ebbs and flows, as opposed to just like this is the answer. That's just education again. We're back right to education.
Yeah, and we've really kind of, I think, focused a lot on the early career. So
Mhm.
then the next question is, how does mentorship change with the seasons of your career or seasons of life? So,
Yeah.
students versus early career professionals versus more experienced practitioners. What are the different approaches to mentoring that people can engage if they're mentoring somebody who's maybe a little bit more seasoned in the
Mhm.
profession, in their healthcare field?
Yeah, and one of the biggest things here, Stephanie, is we've talked about vulnerability, but also making sure that we unstigmatize. I don't even know if that's a word, but we're going to use it to decrease that stigma of mentorship. Seeking mentorship as a seasoned professional means that I'm not adequate, I'm not good enough, etc. So, we learn from textbooks, we learn from labs, we learn from social media, YouTube videos, etc. We learn from our clinical rotations. But as we grow in our profession, we're going from 1 year of practice, 5 years, 10 years. Let's say that mentorship didn't exist, right? Let's imagine what that world would look like if if our progression as healthcare providers was solely dependent on continuing education courses. There are phenomenal courses out there, but there are also courses that don't really provide a lot of, return of investment, let's just say. So even if I go to either of those courses as a clinician 5 years, 10 years down the road, and I learn the content, great. I've learned academic knowledge. I've learned didactic content. I know a little bit about how to apply it, but it was one instructor with 40 people, right? So if I have an appropriate mentor that can help me with that specific, um, perhaps knowledge gap, and help me bridge theoretical knowledge with actual patient case scenarios, through examples, through resources, through providing me with potential other people that they know within with their network to help me really solidify that knowledge. That's what we lack. And as you and I will know, there's 100,000 some therapists, but our world is really small. And I think all of us know somebody that practices in something that has X amount of personalities that we can really refer out. So it is harder for a clinician that's seasoned to ask for help. And we have to normalize that. Just like we're talking about normalizing mistakes, we should normalize asking for help. And we should normalize, like Shirley Sarman was talking about, making a mistake and asking for help because I don't know really what I'm doing. One of the biggest things that I teach my students when I teach them acute care is to know your limitations. Don't ever walk into a patient's room that has everything and say, I can do this. So if they're not with me in a classroom and they're by themselves, like I found myself 10 years ago, I had my senior PT who was great at training me on how to do things. But when it came to the empathetic side, the emotional side, the even how to address specific situations with the team, how to become more confident in how I communicate my recommendations, etc. That was me, myself. And as I reflect on it, I made a lot of poor decisions myself too. And I'm sure that many of us listening can reflect and say, yeah, I probably made a lot of poor decisions. And if I would have had somebody to support me, again, not to hold your hand and not to give you answers, but to support you, you would have, I mean, I think tremendous, much better outcomes. Ultimately, once again, we're providing the power of choice through our platform, but it isn't the power of choice that we're so interested in. Um, my mother had a small neurological surgery last week, and so PTs came to see her. And when PTs were coming to see her, the entire staff there said they were amazing physical therapists. Now, I don't practice in neuro, but I think you and I both know when you have a family member that's in healthcare, dynamics are weird. I left the room because I wanted the PT to be themselves and do their things without the pressure of me being in there. Once I came back, I didn't ask my mom what they did. I didn't say, like, what did they have you do? Was it good? Was it bad? I asked her, were they nice? Were they good with you? Were they empathetic? Did they listen to you? Did they explain everything to you clearly? Did they handle you with respect? Did they answer all your questions? Do you feel like the session was what you needed? Right. And that's part of healthcare that we miss because we're always so focused on the actual knowledge. So for us, we provide you with mentors, patient outcomes. These new healthcare providers are going to be the people who put their hands on you and myself and our families. And as seasoned providers, we just need to really get rid of that stigma that asking for help is a weakness because it really is not. Yeah, I believe it's a strength. Acknowledging your mistakes, huge strength, not a weakness.
You had mentioned the impact of outcomes, and I know you were talking more about patient care, but how can the impact of outcomes be measured or assessed in mentorship?
Yeah, sure. So again, I think that even for myself, before I started really getting into the world of clinical mentorship, there's a potential misconception between many people that the outcomes of mentorship are purely subjective. I helped them; they were great. We had a good relationship, all these things. But ultimately, outcomes can definitely be measured. So you have you're mentoring somebody who is having difficulty with treating their patients for whatever reason. When you mentor them, the questions shouldn't be like, okay, so what are you doing wrong? Tell me what you're doing so I can fix that. Is tell me more about your patient population, right? Let me understand your patient population. How are they, and from your perspective, when you're done with them, how much do they improve? 50%, 75%, 100% of the time. And then even asking just generalized questions like that help them really formulate this sort of ideation of how their patients are improving. So if we have the ability to share knowledge between each other in the form of mentorship and help each other grow as part of giving back to our profession, we can start seeing that we'll hopefully start seeing that providers are going to be more dedicated, more empathetic, right? More really treating the patient holistically, because let's be real, burnout is huge right now, right? And a lot of people are transitioning from non-clinical from clinical roles to non-clinical roles. So if somebody's riding that line between burnout, whereas they start seeing each patient as a number because they're just tired, let me just get you through. Let me just get you through. Let me just get you through. If we can get rid of that by grounding them and helping them understand what the patient's story is, what the patient's needs are, that's so much more powerful than if I were to sit there with that individual and teach them how to perform the intervention precisely. You need to be able to understand the patient's story. Um, yeah, I mean, just that connection is huge.
So one of the advantages that people cite about, let's say, a residency program, which in the profession of physical therapy, residency is not something that is required, in the physician model, residency is required.
Right.
And what the residency model emphasizes is this idea of clinical mentorship.
Mhm.
And the research does support that people who go through a residency or a fellowship program,
Yeah.
or are trained as in residency and fellowship in this field, in the profession of physical therapy, they have better patient outcomes than
Mhm.
people who are not trained in those various methods of formal clinical mentorship.
Right.
What are your thoughts on, if somebody is really interested in this clinical idea of clinical mentorship, what are your thoughts on the profession of physical therapy requiring residencies to help develop this advanced level of practice?
Yeah. Oh, you're putting me on the spot on this one. I love it. So, all of us in physical therapy, I should say, regardless of residency or fellowship or not, right? We were trained mostly through textbooks, eventually through labs, clinical rotations, right? So we have the option of residencies. Residencies are amazing. Residency fellowships are great. I want to ensure that what I say doesn't come off as I'm devaluing anything, because it is not. I guess in summary, I'll tell you, I believe that we should have residencies and fellowships, right? But I want to kind of come back to that, what I was talking about initially. Residencies and fellowships are incredible. You're right. The literature does state that patient outcomes improve when somebody is trained beyond just walking out as an entry-level clinician and have a license and get a whole patient case. So tomorrow that they learn how to treat from, I don't know, 7 months of clinical rotations and 2.5 years of reading textbooks. So they're great. I think they should be required. But at the same time, when you're looking at a residency and a fellowship, what we're really trying to do, and I'm sure a lot of people won't agree with this, is make sure that we define what is an educational experience versus what is a mentorship relationship. Because once again, and I have a lot of colleagues that went through residencies and would tell me about the nightmares of feeling like they were failing, but now they're great clinicians and how they were treated, blah, 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 and all the pressure and all that's, all those concepts are good depending on the individualized needs of the person in terms of their learning style. But ultimately, once again, they have, I should say they, but like the residency directors have the hold of whether you're going to pass or fail your residency. So education, and then we can start perhaps even in residencies, in fellowships, having a formalized mentorship program that is separate, but on top of what the individuals are learning, right? And this doesn't mean that now I have to have mentorship for another 2 hours. Let's mix it in. Let's make it a standard. Let's prioritize that. Our platform gives you nationwide people. If that's not the thing you want to do, find and structure a mentorship program that'll work with the didactic knowledge that you're teaching clinicians, because it's a lot more than just learning how to perform skills and treat patients physically and what have you, that is required. And so I still firmly believe that true mentor should not have a hold over somebody's future.
So how can organizations promote this culture that values and supports mentorship in this way that you're describing, where there isn't this power dynamic? It's more a collaborative effort. What advice do you have to organizations to promote this type of culture?
I say it's simple. It's likely very complex because I'm not any of these organizations, but I think that I strongly believe, and my partners and I strongly believe that organizations really need to prioritize mentorship, and reduce the amount of pizza parties they give people, right? Like, let's really get a mentorship program going, and let's ensure that the mentorship program is solid. And once again, that it's built into some sort of training or some sort of longevity, as opposed to now you also have to have a mentor, right? New grads need a mentor. Think about what the pandemic did to our professions, healthcare. So many people went traveling, right? And you have new grads who got their license yesterday based, again, on textbooks, labs, clinical rotations, going from one spot to another, to another, to another, and it's all brand new to them. What's to say that they're performing at their best when they can have mobile, virtual, 24/7, whenever they want mentorship? But organizations need to start prioritizing mentorship and stop falsely labeling an event or a handshake or they're going to train you for 2 weeks as actual mentorship and label it as it is, because if we have those new mentorship programs, it will reduce new grad stress tremendously. Reduce burnout in a lot of people because they'll be able to handle their days better. They'll have somebody to rely on, somebody that they, to support them, as opposed to going to your department chair and saying, I'm staying really late documenting. Well, let's work through some strategies to help you become a more efficient provider. Let's talk about your day. Give me 100% what happens one of your days. Maybe I can help you sort of fix that, right? So we talked about measurables. We strongly believe that if we implement and prioritize a mentorship program, a good mentorship program, job satisfaction is going to increase, retention will increase. I mean, that data is out there with a lot of corporate America. Pay increases because we are just better clinicians overall.
What advice do you give to someone who wants to become a really great mentor and aspire to these qualities and to these attributes that you've been speaking of?
Yeah, the first one, and we've repeated it several times, you and I, Stephanie, is well, two of them, right? Be vulnerable and be humble. The mentee mentorship relationship is a two-way street. We learn from our mentors as much as they learn from us, and we have to be open to receive that knowledge as well. It isn't always about providing them with knowledge, right? So becoming a mentor, I would advise somebody who wants to become a mentor to really focus on, instead of thinking about pressuring themselves to, okay, I have a mentee, I need to know all these things, I need to review all these things and study so that I can give them the right answers. Instead, share experiences with them. Share experiences that you've had that relate to what they're going through and how you overcame them, right? Be patient. Set very clear expectations from the beginning. Maintain open communication and set boundaries, meaning, look, we're going to meet XYZ, right? Or as much as you need, as much as I can. Our platform allows for your calendars to be uploaded, and you can say when you're available, online, offline. So it's just about being completely transparent, but being humble, being vulnerable, and really sharing those experiences. And the biggest thing, in my opinion, is the piece of clear communication, has that from the beginning. And look, if I can't be your mentor because I'm just not appropriate, I'm going to admit it to you, but I'm going to help you find somebody who can.
I think you hit the nail on the head really well by saying that communication is the key and setting expectations from the beginning. Because if you don't set those expectations right away, then the balance of experience may go awry, and making sure that the expectations are known for both the mentee and the mentor. And then you had mentioned, sharing your own experiences. Can you share a personal lesson or an insight from your own mentoring experiences with our listeners, just to kind of give us a good concrete example?
Yeah, no, absolutely. I've Okay, so what I'm going to say now sounds contradictory, but I'll correct myself, I promise. First, because of the setting that I practice in, when I had clinical students in clinical settings, in cardiothoracic ICU and things of the like, a lot of times there were deer in headlights. So I helped, in my mind, years and years ago, mentor them through the process of how to apply their clinical knowledge to treat the patients correctly. But lo and behold, reflecting on those experiences now that I really am truly understanding what mentorship looks like, I was more so educating them, right? So what's happened in these last few years, I have, colleagues and friends who have sent somebody to me. I mean, I've had, somebody in Texas, Florida, and I forget where, again, I have zero skin in the game, right? I have no ability to fail or pass them. And I'm able to help them through their issues, whether it's didactic knowledge or how to apply those concepts into real patient case scenarios based on my examples. And something I love to use, and I'm not afraid to admit it to thousands of listeners, is all of my mistakes. Because if I share the mistakes that I've made in my career based on not having who they have in front of them today, right now, my hope is that they won't make those mistakes. And slowly, even if it's a little bit at a time, we start really prioritizing how, patient outcomes and how we treat patients. So I share my experiences with them. I've made a lot of mistakes, some that, when I think about today, I'm like, why did I do that? But I had nobody to support me, nobody to really help me understand how to fix that issue beyond telling me, yeah, you probably shouldn't have done that. You probably should have read that lab value a little bit better. You probably should have looked at the chart closer. You probably should have spent more time reading the medical chart. Yeah, but that wasn't the support that I needed. So I've loved those experiences because I think going back to the setting expectations and goals, when I've communicated with these individuals that I've had the pleasure of mentoring, it is never, I set the expectation, like, I'm not here to teach you. Like, that's not my role. I might teach you some things, we'll have those conversations, but it's to support you and help you grow and help you understand the things that you're not understanding and provide you with the resources. And just honestly, be a cheerleader, because it's one of those things, Stephanie. I love my wife to death. She tells me I'm handsome. I'm like, thanks, hon. I love you. But when somebody that you just know holds no skin in anything tells you you're handsome or you're beautiful, it's completely different. So when I'm able to do that for the mentees that I've mentored, instead of their faculty or their supervisors telling them like, you're doing great, it's just received completely different. And so, yeah, I mean, I've had great experiences once I really realized how to lead that conversation with mentees, how to be a mentor, how to, do my motivational interviewing, letting them speak and let them critically think for themselves, as opposed to, oh yeah, let me tell you why that's wrong and let me give you the answers. That's just me teaching them stuff.
Well, thanks for admitting your mistake on this podcast. I hope that empowers others to be okay with talking about the learning experiences that they've had through mistakes and even successes, because, successes
Absolutely.
can teach us.
Absolutely.
But as Winston Churchill says, failure teaches us even more. So the last question I want to ask you is one we ask all of our guests. And that is, if you were to give your 25-year-old self one piece of advice, what would it be?
To not be so cocky, to be honest, because I had a great trajectory in PT school. I did well. My first job was my dream job. The world was just in my lap, and I thought that I was just the best at everything. And in reality, I was a horrific therapist because I did not seek mentorship. I did not seek help or advice. All I waited for was to make a mistake and for somebody to correct me. So the advice I would give was, look, you're a new grad, you're 25 years old. You're not done. Lifelong learning isn't just continuing education courses, isn't just reading manuscripts, isn't just reading textbooks. It's communicating with others and finding others who have had similar experiences that can help you grow as a clinician. And I hopped on that train way too late.
Well, thank you for sharing your expertise and your insight today with us. And is there anything else that you would like to tell us as to how our audience can get a hold of you if they want to contact you, if they have more questions for you? Where's the best place that they can reach you?
Sure, yeah. So they can reach me at info@scholarnetics.com. That email comes right to us. I give you my personal one, but then it's going to get confusing. We can maybe put it in the text. But we're still, as we're building the platform, if any listeners email us and they're interested in becoming part of our beta user group, just email us at info@scholarnetics.com. We'll make sure that they have special pricing, special privileges. They're part of our beta group. Just let us know that, they heard about us in your podcast, and we'll make sure to take care of everybody. We're here to help. And I'm happy to answer any questions that any of your listeners have.
So we'll put those links in the show notes, so look out for those. Thank you so much, Eder, for connecting with us today. And thank you for listening to another episode of the Healthy, Wealthy, and Smart podcast. Have a great day.